Welcome back, and many thanks for staying with us on the number one breakfast show in the country. Morning at NTV, we've noticed an exponential rise in the number of COVID-19 cases being registered on the whole global stage. Starting with Uganda here, 87,277 cases of this very, very heinous disease have been discovered in this jurisdiction of ours. Unluckily, 2,104 people have actually succumbed to the novel coronavirus disease. 61,304 have actually recovered from the novel coronavirus disease. The government has not actually sat on its hands. Yes, in its wake, it has decided to start giving out money, 100,000 Uganda shillings, to those people considered vulnerable. Now, the biggest $64,000 question is, who is vulnerable in this regard? They are looking at the taxi operators, the conductors. They are looking at the bus drivers. They're also looking at the pregnant or single mothers. They're looking at the ghetto youth, the people within the slums. And we do know that Kampala is taking the biggest chunk of all those beneficiaries, with over 157,000 people being registered here in Kampala alone, a jurisdiction that has 1.7 million people, yes, at night, and 2.5 million people during day. That is for a fact. Kampala has 2.5 million people during day and 1.7 million people at night. We also do know that other areas are also grappling all the same. Nansana municipality is having 34,000 people who are vulnerable. You have Kira municipality that is having some 31,000 people who are vulnerable. You have Makindi Sabagawo that has some 21,000 plus people who are vulnerable. So we want to talk about who is vulnerable and who has been left out. Is this 100,000 Uganda shillings enough an intervention to actually offer reprieve to the people of Uganda? Lydia Onyoto, the chairperson of the NRM Women's League, is already here. We shall be joined by Flavia Kalole Nabagabe later on. She is the head of NUPS Women's League. Very good morning, Lydia. Thank you for joining us right here on Morning at NTV.
Good morning, and to our viewers and listeners, a very happy Monday, and I wish you a good week.
Indeed.
Ahead of so many challenges, but we are there.
All right. Talk to us about this COVID-19 pandemic. It comes at a time when many people are grappling, when people are falling below the poverty line. How would you rate government's intervention when it comes to COVID relief, money, and so forth?
Experts have told us that this is what they call the second wave. Last year in March, we began off with the first wave. It was not as aggressive, as brutal as the second one that we have experienced in the last few weeks. And I want to stand with those that have lost close relatives and family members, but also to the country that has been hit into a panic.
Indeed.
To save lives. I stand with the medical workers, those who have saved lives, but also those who have lost their lives, and the efforts that by the government and all Ugandans to keep safe. On the issue of, there are many fronts that government has been put in place. We all know in terms of interventions. One of them was the measures related to the lockdown, but also the upping of the health system to help save lives, both the private and public. I've seen efforts for them to work together to save lives. We appreciate all that.
Indeed.
There's also the aspect of relief, because when the lockdown came into effect, it meant that people who survive on hand to mouth had to stop working, and therefore they could not feed themselves. So government came up with a relief support system that it does not solve all your problems, but can put a little food on your table. We call it like some Panadol. You have a headache, before you know the cause, you take a Panadol to get a relief. So the 100,000 is not supposed to solve all our problems,
Indeed.
but at least a relief for those who are really vulnerable. Vulnerability in this context are those who have been surviving by the work they do, and because the lockdown came into effect, therefore they cannot earn anything for their daily food.
So essentially we are targeting that individual who was working at some point, and now they are not
because of the
working
lockdown
anymore.
he cannot work.
Now there are people who haven't gotten any kind of work even before the lockdown. The people in the rural areas. I was maybe a subsistence farmer. I didn't have any kind of employment. Now during the onset of the pandemic, it has been hard for me to get agricultural inputs. It has been hard for me to get any inputs to go to the farm to till. So ideally I do not have food at the farm, and I do not also have a job. I'm double vulnerable. But but the government believes I still do some kind of farming and I have food. Shouldn't we be looking at this group of people who might not be having anything to eat?
The 100,000 relief for this hand-to-mouth in the towns is not cast in stone. But also government operates within a particular envelope. So the debate is out there. I think let's first of all handle these emergency cases that they were able to identify. But the campaign is out there. Even me, if I have some food, or even you, we can still reach out to people. But let's give government a chance to first of all sort out these 500 people who are really, by virtue of no work, they will starve to death in the towns, in the urban areas. We appreciate the description you have given. Those are new developments, those are realities, and let people speak out. We hope that when we finish the 500,000, we can roll out another campaign to support any other category like the one you have described. And we don't want to close that. It's appreciated. And let's listen into more complaints. This is a country on fire. We have a crisis. Nobody prepared for this pandemic, but we are supposed to be ready. We are supposed to be disaster prepared. So that's my thinking, and I would like to support any effort that if we can't go beyond 500, let's see how else we can help those who are not in this category. They could be there, and they are there, but let's not close the door.
And indeed, you have individuals who are saying, so what criteria did we use to come up with the 501,107 beneficiaries? Yet last year, we did have some 1.4 million people being given food by the government. So people were wondering, how did the Ministry of Gender come up with this figure of 500,000 beneficiaries? Yet last year, we had 1.4 million people who were given food.
It had a multi-pronged approach. First of all, they used the statistics that were used the last year in March, but also they were able to do the kind of validation, verification exercise. They took this data back to the community. You had people saying, oh, in this village, only 5 people are here, the others are not here. That was a validation exercise. So over time, we've been able to get the correct beneficiaries, and the categories are more clear, but they may not be enough. I'm very sure that it's not only 500 people that need this money, but let's begin with this 500,000 whom we have got from the cities, who are obviously cut off from their daily income. And then I think by the end of this week, we should be able to now listen into those other categories like the ones you have mentioned, that in the beginning we did not give first priority because of the nature of the funding. But I see a lot of people committed outside even government to help. So this is a very good effort for Uganda and a good spirit for all of us.
Of course, you have some people who are up in arms and they're saying we are using an old list for last year's intervention, and many of the people we are giving this money are already well off. That's what they are saying.
No, the list that there has to be a history. It's all about COVID, and the categories are the same. The list that was used last year was like the available data, but was used for validation. It was taken out there to display, to do minus or plus, to remove those that have already come out of the vulnerability bracket and put new ones. But also, as you know, towns, actually people have shifted. Also to remove those who have left, and also the new ones who have come. But by the virtue of the lockdown, they have stopped earning their daily income to which they survive. That is the description, and it's very basic. But also, we want to agree that there could be more than 500,000. But government at the time, the money they had was enough to cover those 500,000. But nobody is sleeping. They are also trying to look at other categories. As soon as these ones are done, they'll be able to, I think, do a review and actually account for the 500,000. Because people are beginning to say they're not sure, because the exercise is so neat and seamless, people think that money is not moving. But it's very difficult for someone to announce that they've got money. They receive money, the message comes and they keep quiet, but they're not complaining. So if you hear there is a bit of quietness, it means that money is going, and when those who are vulnerable are walking slowly to a market, buy something small, go home and keep quiet. But what I thought government should do is to publicize after whoever got this money, so that there is a clear accountability process. Because this time around, You're not seeing anybody carrying food and going on the doors and even spreading, exposing people to corona. It's quiet, it is seamless, it is neat. So, but I think like at the end, let's now publish the 500,000. Maybe not the people, because of maybe there's also an issue of stigma and dignity, that when you give somebody, you don't have to publish them, but accountability is important. Let us know the 500,000. Then from there, we can now struggle to look at other categories. People should remember that as we work on the relief, which is also important, there's also the campaign of saving lives, the issues of vaccines, so that we are able to secure people's lives, but also treating those who had already been brought down by COVID. So the government is overstretched, but I think that we are making progress. Because you know very well that statistically, the admissions are reducing, which means that the lockdown is working, and people have been able to heed to the measures of the standard operation procedures, the SOPs. So we should be happy that we might defeat this problem.
Let's go back to the COVID relief money and why we believe as NMG that so many people might be left out. According to the information we have been receiving as morning at NTV, the town clerks are displaying the old register for last year, and they are not actually doing any kind of update. They simply got the list from the Ministry of Gender and displayed it as it is. So meaning no updates have been done. We also do know that the mayor's office, that is Elias Rukwago, it's up in arms, and they're saying, why did you bypass the mayor's office and the LC1 leadership, which actually is always in close proximity with the people, and go for the town clerks? The town clerks are not updating these lists. They're simply putting them up as they were last year and saying these are the beneficiaries. Well, talk about that, Lydia Onyoto.
The reason why the town clerks were directed to put up the lists as they were, so that wananchi who are vulnerable, whose categories have been read out, can now go and say, this one has shifted, this one is out of this category of vulnerability, but this one is now the right one. And if the town clerks are not changing those lists after the display, there are other stakeholders who will make it sure that those lists are updated. I like the noise, I like the complaints, because then they are answering the reason why they were directed to display. If there was quiet, then there would be a problem.
What about
so
the
let people come out and complain. And I also want to appreciate the leaders. I've seen local leaders like councillors, national leaders like members of parliament. They've gone home to join. That's why you're hearing the categories left out. This is a very important open exercise. But all I'm trying to explain that you should not die there. Come out and bring out your issues. We have other line of leaders, councillors, the office of the RDC, but the town clerk was given because they are the ones who license the categories that became vulnerable. They're the ones who license taxi drivers. They're the ones who license all people who are doing things in town, whose daily income has been cut off because of the lockdown. But if there are other vulnerable people, let us as leaders gather that data, like now our backup, the follow-up exercise. The good news is that the pandemic is coming down, the infections are becoming less. So as we struggle, we might actually have an easing of the lockdown, but let's not forget the fact that without vaccines, we still have the challenge. So the campaign of vaccines is ongoing on one side. Facilitating and equipping hospitals is also happening.
Indeed.
The mobilization to people to keep safe is also happening. But at the same time, we have not forgotten the campaign for relief.
Lydia Onyoto is the chairperson of the NRM Women's League, and she's here with us on Morning at NTV to expand more on the COVID-19 relief money, which kicked off last week on Thursday, exactly 21 days after President Museveni called for a 42-day lockdown. So essentially, we are remaining with some 3 weeks to exhaust this 42-day lockdown. Yet, some people have not received money. And since they do not have national IDs, it makes their situation very, very hard, because the government is not going to give you that money if you do not have a national ID. ID. If you have not gone to the National Identification Registration Authority, that is needed to get your ID within a week, and that is the biggest nick right now. We are also joined by Flavia Kaole Nabagabe, the Kasanda Woman MP, and also the chairperson of NUPS Women's League. Very good morning, Flavia.
Good morning, Romeo.
Glad you could join us.
Thank you very much for having me.
All right. We are talking about government interventions. How would you rate the the central government when it comes to relief interventions during this COVID-19 pandemic?
Good morning, viewers, and I want to thank you and appreciate my co-panelist, Lydia Onyoto, for sharing her insights into the COVID-19, but also to appreciate you, Romeo, and the NTV for keeping us abreast with the updates of the COVID-19 situation and also keeping people entertained even during the lockdown, because the state of mental health is also something that is very critical at this time. People are hopeless, people are desperate, people are angry, people are suffering. So anything that we can do to ease that can also be a very good outcome for them. So I want to, first of all, appreciate all Ugandans that are struggling with the COVID-19 pandemic, but are trying to get all ends meet and ensure that they survive during these very critical times. I want to appreciate all the health workers, especially those in the line of duty, that are doing everything that they can to ensure that they save our lives. As Ugandans, despite the difficult challenges that we have come across once in a while, most of the times in this pandemic. Especially, I appreciate those that have passed on in the line of duty. We commiserate with their families, and we really send our condolences to anyone who has lost any loved one during this time. We are praying for the sick to get better. We are praying that those that have people at home that they are taking care of can be able to, get comforted as well and be able to overcome this challenge that we have. I know for a fact that in Kasanda district, my area of jurisdiction, I know that we have lost so far only 6 people, which is really, really bad, because every life matters and we shouldn't lose any life in this pandemic. So everything we can do to control and to ensure that we don't lose more people is of greater concern at the moment. We have one currently who is still in the ICU, and we are praying for them. We have lost 3 health workers, which is so sad. We have 59 people who are positive, including 3 health workers. But also, we have a number of challenges there that I wouldn't want to delve into right now. But I would call upon everyone in Kasanda district. We have only 3 testing points. That is Kasanda Health Center 4, Chiganda Health Center 4, and Bukuya Health Center 3. That's where we are testing from. We are about 363,000 people in Kasanda, but we only have 229 that have been checked, that have been tested for COVID. That is a very alarming number, because we know so many people are still out there at home, not able to test, and yet there is free testing at the health centers. So I call upon everyone to ensure that they get tested, but also those that we have a number of them, according to the DHO, that are under home-based care. We need the people in the homes. We need more community sensitization so that people can know exactly how to take care of these sick that are at home. There's also the aspect of stigma. People who get COVID-19, the family members don't know how to treat them. The community members don't know how to treat them. So you end up getting people that are left alone, and they die or they suffer silently. They cannot come out to talk about it. They cannot come out to test. They cannot come out to declare that they are being tested positive. So in the end, at the end of the day, you find that we have a number of people mingling with such characters, and so there's wider spread of.
Are they not coming out simply because of the COVID-19 total lockdown, or are they not coming out simply because they are fearful of the fact that where they are going to seek help, the medical center, COVID-19 could be rife? Okay,
so there are 2 reasons. One, the health centers are very fast, so they cannot go closer to the health centers. To access, the accessibility is quite difficult. But also, we have had VHT teams that have been working with the DHO's teams to ensure that they reach deeper into the communities to test for people. And a number of people fear. They just have a fear. It's a mental state. They say once they are tested positive, so it's like the HIV/AIDS pandemic when it had just started. So people are worried. They're like, if I come out and speak about it, I will be stigmatized. I will not be able to fit into the community. And you know our people in the communities. It really matters that people see them differently. So there is also that. So I think there needs to be more community awareness around this disease.
And how it works.
Yesterday I was in Kasana and a number of people were totally unaware that this disease is there. It kills. So many people are not wearing masks. So many people are mingling in towns. You know, they are not working, but they leave homes to come into towns to just pass time, especially the young men and the women. So we need them to be aware that COVID is real. We have lost lives in this pandemic. We have a number of people that are suffering. The effects are even more impactful than what we can see. And so they need to take care, because in our villages, the safest way for anyone who cannot match up, who is not even a rich person, is to wear a mask. That is the easiest and cheapest way you can avoid the disease. So I call upon them to do that.
Before we rate the government's intervention efforts, let's talk about the other fact, the lockdown itself.
Exactly.
Do you think it was called at the opportune moment when cases were rising exponentially within Uganda? And do you think it is the only solution that we had to curtail the spread of COVID-19?
One, I think the lockdown was a necessary evil, if I can call it that way.
I hear you.
Yes, at some point we are really, the pandemic was spreading really fast. And unfortunately, people were not taking it so seriously. So we needed a lockdown to kind of slow down the virus. However, in order for us to go into a lockdown, the government needed to have planned prior to the lockdown. Planned effectively prior to the lockdown. Not this kind of planning, laissez-faire planning that you see that they were able to take us into. So they threw us into a lockdown without fully planning for how we are going to survive under the lockdown. We were blessed in disguise that last year we got a warning, the very first wave of the COVID-19 pandemic in Uganda. And we had already witnessed how it had affected a number of people across the country, across the continent and across different continents. And so this was already a fair warning for us to plan better. We have departments that plan for disaster, because this is like a disaster really. It's actually a disaster because even the way it has been managed is disastrous. So we have a number of, we have the Ministry of Gender, we have the Ministry of Health, we have a number of ministries and sectors that could ably plan for this pandemic. Unfortunately, the issues we are now grappling with under the lockdown are issues that should have been addressed earlier. For example, the food relief program. Yes, when you're sending people, especially people who are used to working and earning and their daily source of income is, it's basically food to mouth. I mean, hand to mouth. So if you have such a category of people, you have to plan very seriously for them. If you're sending them in a lockdown, how are you safeguarding, first of all, their right to health, their right to food, and their right to life? Because right now we have that crisis that so many people are grappling with keeping alive because of the different challenges we see in the health sector. We know for a fact that when I look at the women's situation, this COVID-19 pandemic has aggravated the situation of women. I know governments are grappling with how to balance the gender question in all this, how they are planning for it. But we also know that under any pandemic, women and girls are most affected. Now, if you have more women and girls that are affected, how do you plan equitably for them? In the food relief, would have said how many female-headed households are in the municipalities, or in the towns, or in the areas that they chose to work with. How many of these female-headed households own phones? Because now we are going to use that as one of the biggest platforms, mobile phones. How many of, because it is common knowledge that most people, most women do not own phones. Most women depend on their spouses' phones or depend on their brothers' phones for use. So now how are you going to send relief to that family without? Secondly, we are looking at the escalated, escalated issues around gender for women, high teenage pregnancies. Last year in my district was reported among the districts that had a high rate of teenage pregnancies, and girls were unable to go back to school when there was a break in between for them to go back because of pregnancies. So many young girls are seated at home right now doing nothing. So if they are doing nothing and they have so many things enticing them, so many men that are also doing nothing out there looking at them, the cases of rape are going to increase, the cases of sexual abuse, child labor, all those cases are prostitution, all those cases are going to be aggravated. So we had to plan with those unique gender issues in our minds to be able to sort them out. Food relief was given 54.9 billion shillings in the OPM's office. But you also know for a fact that the State House budget is much higher than this. In fact, it's I think it's last year the State House budget was 410 billion that was given to them last financial year, and it was even revised in the half year to 861 billion because they asked for a supplementary budget. They had already used up a lot of that money, and so we see that there's a lot of fiscal indiscipline in some of these sectors. The president has donations, presidential donations, a whole budget of presidential donations to himself. In these times, what should have been moved and planned for is, this time people are under lockdown. The president is not moving around a lot. He's not donating to so many things. You know, can we cut his budget, transfer some of that money into the Ministry of, into the OPM or the Ministry of Health, who receive 54 billion shillings. 54 billion shillings is meager. It is very little for a whole country of over 40 million population. You're just targeting just a handful of Ugandans. So if we have such budgets around, lying around, why don't we transfer some of that, the costs from those budgets, into what is more needed in the health sector? Because we know for a fact that the health sector's budget was reduced in this financial year by 9.3%. So if it was reduced, and this is what is the most critical, how then do we move forward as a country? So I think for me, there are a number of gaps in this lockdown. We have seen the gaps of people that are struggling to pay rent. I cannot tell you how many phone calls I get from you, from different people trying to help, calling me for help for their rent, calling me for help for food, calling me for different issues. So how do we go about this as a country? First of all, as women and as the National Unity Platform Women League, which I chair, we are deeply concerned and we are deeply aggravated by the fact that we have women who are at the heart of the scandals that we see in the Ministry of, in the COVID-19 funds, you know. It is so bad.
And they're also the majority within agriculture.
Exactly.
Over 65%.
Exactly. So it is just deeply annoying that as we push for women to be, women to occupy these spaces of leadership, these very powerful spaces of leadership, at the same time we get women who get in there and they forfeit why they are in there. This is a very critical sector. They know so many women are affected by this sector. They know that a number of issues for women and girls pass through these sectors. But this is the sector which we have seen that has over 230 billion shillings amounting to scandals around COVID-19 funds. That is being mismanaged, money that is being grossly mismanaged, the levels of impunity that are terrible, that people are just looking to us helplessly as well and trying to find solutions from us, yet they are the government. They're supposed to plan for us. But besides that, I would also want to talk about how Parliament has been deemed redundant during this entire time. You know, Parliament is the people's representation and voice. Ideally, we should be able to tussle out some of these issues in Parliament, to be able to find critical solutions to some of these really critical, challenging situations that we are in. But we have a Parliament that was signed on what? On recess for 2 weeks. In the 2 weeks is when we saw the escalating issues of the pandemic arising, because that was 2 weeks almost of a lockdown, 3 weeks of a lockdown. So our voices were stifled in that way. Now we are saying, can Parliament sit again? I am very glad that eventually our voices have culminated into a response.
Indeed.
And tomorrow we are going to be able to sit and be able to raise a number of these issues. But also, given that we are in control of the budget, we can see how to, you know, reshuffle, move around the funds so that we can direct funds to what is really needed, what's important. At the moment, what is more important to our president, the country, was the security budget, which he added more money to buy more tear gas. We just came out of an election, which was a do-or-die affair for the president, which was a bloody affair for the president and for the people in the NRM. They bought a lot of tear gas. I'm sure they even have expired tear gas in their places right now. And they are trying to see how to, I wish they could convert that tear gas into health sector, vaccines, into ICU beds, into, you know, oxygen for people in hospitals. But they have a lot of that, and they have so many guns, and they have so many things that are moving into security, and yet they are leaving the critical sectors. The JLO sector
so
is
the main,
under lockdown at the
main
moment.
reason is poor prioritization coming in from the central government.
Exactly.
Flavia Kalule Nabagabe, she is NUPS head of the Women's League. We also do have Lydia Onyoto. She is the chairperson of NRM's Women's League. Lydia Onyoto, let's talk about another issue that is also taking center stage. This COVID-19 relief money comes exactly 3 weeks. Thursday last week, it was 3 weeks after President Yoweri Museveni called for a 42-day lockdown. Now, some people do not have national IDs, meaning they might not have access to this money. They'll first have to go to NERA. By the time they leave NERA, it will be maybe 2 weeks left to the end of this lockdown. So we are anticipating a situation whereby we get out of the 42-day lockdown before some people even get this COVID-19 relief money. What do you make of that, the slow response?
Of course, first of all, Flavia just came in, Honorable Flavia Karole. I wish to congratulate her. She's the first woman MP for Kasanda district. Kasanda is a new district. So with this energy and new leadership, we hope that the challenges that were not addressed when it was part of Muvende now have a leader that is close. Yeah, that's why we have these new units, so that people who were suffering under bigger entities can now have a leader that is closer to them. So congratulations, my sister, and I wish you a good tenure, 12 of duty as the first woman member of parliament for Kasanda. The issue of people who don't have telephones has also been addressed, and IDs have been addressed by the National Task Force of the Relief, National Task Force on COVID. They talked about coupons, but remember, like that all local leaders, especially the LOC ones, you hear about the town clerk. The town clerk is part of the structure, but there are people that are overseeing this exercise. The local leaders, the councillors, she's here. She's talking about them going to parliament tomorrow. They are important stakeholders. They even put up a task force, which is now in the field. This is everybody's business, because COVID is not choosing which person to attack.
It doesn't discriminate.
We are all in this. It doesn't matter whether you are a politician or not. So it's a responsibility for all those who are stakeholders in it, and I'm happy that they have taken up that responsibility. Many of them are in their constituencies, but they are, I think, on their way back now because of tomorrow. When the president was issuing directives about the lockdown, I clearly listened to that address. He said, except the legislature and the judiciary. So those entities, those institutions, had to work out their own SOPs on how they are going to participate in the lockdown. He did not close parliament. He did not close the judiciary. So it's according to those institutions on how they can sit and work out their own mechanism to see how they can work in this season. That was on TV. So I think that's not the fault of the executive that announced the lockdown, but the legislature can sit down like they've done. I saw them putting up a task force. They are in the field. They are now the choice. They have now said that they can meet tomorrow. Really, that's their business, because they were left out to be part of the frontline fighters for this epidemic. And what's coming out for us who are not in parliament or in the judiciary or the frontline fighters, we want to see solutions, because this pandemic, nobody brought it. It has run the world down.
Of course, she talks about poor planning coming in from the central government.
It has run the world down. Uganda cannot be an exception. So for all of you that have a stake in this, we want to hear more solutions. If you want to go back to parliament tomorrow and do some reallocations of the budget, please do, because it's your mandate. Parliament is mandated constitutionally to appropriate budget, but they can work with the executive and make sure that they can now come out. The 58 billion did not come out of somebody's pocket or someone never sold their bananas. The 58 billion was within the budget that you did the appropriation. So if it's not enough, go and increase it, find where it can come from, so that we are able to add on to the 500,000. Because if you are going there, the 500,000 is a small number. That's the first relief numbers. But we are saying that having gone around, because leaders are now in the field, they are more vulnerable people than 500,000. Their work is cut out for them. Their work is cut out for them. My only point is I was saying that let's now make sure that we account for the 500,000 people, and then see who else has been left out. And then the leadership of the executive and parliament can now squeeze elsewhere and say, let's first of all sort this problem. The good news is that the lockdown has helped us now. We are seeing less numbers of infections. But the vulnerables are still at home.
And they're increasing.
They are still at home. And they are more than 500,000. So the work is cut out for them, and we would like to listen to more solutions. I like their campaign.
Indeed.
And the meeting of minds on the vaccine. They appropriated money for vaccines. They are now looking at us not going on the COVAX way because they had gone to buy through the COVAX facility. Now they are saying no. I think we can also look at the open market.
And the biggest
but that
worry
requires more money.
The biggest worry right now, Lydia Onyoto, that we are trying to discuss right now is that as we give out this relief money, time is running out, the 42-day lockdown. And we are saying by the time we elapse these 42 days, some people might have still be not handled as far as these disbursements are concerned, the 100,000. We are talking about maximizing the number from 500,000 to maybe more.
But you see,
even now, according to the slow implementation of the process, we are worried that maybe we might end these 42 days minus some people getting money.
Is it about the 42 days and for not getting money, or is it about doing the thing right?
The slow response.
If there are people who are vulnerable and they are on the list, 42 days is not the cut-off date for them to get their relief. They'll get their relief. But let's get the right people, get money. And do be accountable. That's the right thing. So we'd rather be slow, but do it right and account. You don't want to come here and say we rushed people. I was just giving you an example. It's good to explain to people.
Please do.
The issue of no phones and no IDs. I have told that the stakeholders will account. You cannot be an LC1 chairman and the structure, she also has a structure that takes her up and down. You cannot find an old woman somewhere. She's vulnerable. She has been working in a market or something and it has been cut off.
Yes.
And you say you cannot give her money because she has no phone. They have provided for those people who don't have phones, but they can be identified by the local community and the local leaders. That's why there was a display exercise. And even if they have been missed out, she's here. She has the voice of Kasanda. She should be come and say, in this village in Kasanda, this person does not want to have a phone, and she's been told by the LOC chairman, there is no way that person will be blocked out because she's a leader. She cannot fake people.
Indeed.
And she will work through the LOCs and the town clerk. And the groups of the vulnerable have been listed. And I want to repeat, they may not be all, but let's first of all sort out the 500 and account.
Indeed.
While they adjust the budgets. If there's more money, again you sit. They have a task force, government has a task force, they again sit again and put up another batch of the if they found the money. Because they are working within money and they are the ones who are supposed to help government to appropriate and reallocate. Where I sit is I support. If parliament and government have agreed on something, our work is to mobilize people and to fill in the gaps and say, look, where else can we help?
Indeed.
That's where we are. And this particular pandemic has no color, has no face. It's about Uganda. For once, we are all speaking the same language because we want to save life. Even where there are gaps, like in hospitals, they went and found some areas, the gas cylinders have been overwhelmed, the plants. We don't want to blame games. We want to just say there was a gap in Muvende Hospital. They are lacking 2-3 more cylinders. Please take. I can even carry them on my can't take because we are saving life. Yes.
All right, that is Lydia Onyoto, the chairperson of NRM's Women's League. Let me also bring in Flavia Kalule Nabagabi, the Kasande woman MP. She's also NUPS, the chairperson of NUPS Women's League. Flavia Kalule Nabagabi, let's talk about another issue. Who is being left out? Well, the older people are not grappling that much when it comes to infections. Those between the age of 80 to 89 have a little more or less than 300,000. 300 cases of COVID-19, and those between 90 to 99 are grappling with some 100 cases of COVID-19. But largely, I've been getting calls from the advocates of the elderly. They are saying they are also left out. Money from SAGE is only 25,000 Uganda shillings a month, and they're saying they should be included on this list of the vulnerable, 100,000. What do you make of that, the elderly being left out and so forth? Who is being left out?
Thank you so much, Romeo. And I really want to appreciate the fact that government is trying to relieve a number of citizens over the COVID issue. I know for a fact that persons with disabilities are still left out, and then they haven't singularly been targeted, the PWDs, because if you just take it as a blanket, you know, in the ministry,
and there are 6 million.
Exactly. So under the Ministry of Gender, Labour and Social Development, it becomes extremely difficult to cater to the different unique target groups in there. Now, PWDs are a special group. You don't know who they are. You don't know how you're going to target them. You don't know how you're going to help them, because they even, on top of being a special group, they have more unique needs targeted for them. So how are you going to help them under this 100,000 shillings? Is 100,000 shillings appropriate for them? So while we are planning, let's plan with an element of gender responsiveness in our minds, especially for government, that if you're giving 100,000 shillings to a Romeo who is able-bodied, who can do a certain thing, who can struggle for something, are you going to plan for the same 100,000 shillings for a person with disabilities that has a family to take care of? Last, I think 2 weeks back, we just saw a gentleman who was a PWD that was crying when the security operatives were stopping him from, you know, trying to make a living. And he told them, but I just have a wife who just gave birth. I have kids. I am a person with disabilities. I have to struggle double to be able to raise and to be able to take care of my family. How are you going to help me? So I feel like the PWDs have really been left out in a very huge way. The elderly definitely have been left out in a huge way as well. But also, I'm also looking at some women. But also, I'm also looking at the other population. You know, targeting 500,000 people is just a drop in the ocean for a population that has over 40 million people.
And 21 million adults.
Exactly.
Indeed.
Now, when you're looking at such people, at least try to draw closer to the number of vulnerables, you know, that is in there. We all know that, and this is a fact, that State House has a classified budget of around 105 billion shillings. Now, if we have a classified budget from State House, why can't we get some of this money? And for me, my argument is we need to boost the relief money of the Ministry of Health from different budgets. And it's good that you're going to reallocate, so we are going to be able to look at some of these issues and see how to help. So that we even increase the relief fund from just a mere 100,000 shillings to at least 200,000 shillings a day, because the days are going, then people have, I mean, take an example at the entertainment industry. They've been locked down now for 2 years, coming to 2 years. Since March 2020, they are locked down, bars are closed, Owino, Chikubo. So you look at some of those areas, definitely the levels of vulnerability are increasing. But how do we ensure that we target some of these people to relieve them? So 100,000 shillings, when you've locked me under over a year, what is it going to be? And while we're also talking about this, I am glad that you brought up the slow response and the slow action, you know. We have waited for this money for quite some time. I am glad that it has finally come, but it's also taking a very long process to reach the people immediately, because if they had said, let's churn it out at a go, I mean, we have the capacity to send money to different parts of Uganda at a go. If we could do that, it could have helped. But now we are stuck in a situation which is extremely paradoxical, because people are dying of hunger. People are seriously hungry in their homes.
Indeed.
Romeo, people are hungry and people are going to die of hunger. Now, if we have people who are going to die of hunger, but you also have people who are dying of COVID-19 for lack of oxygen. We recently saw, I think it was your TV here that showed with the women that were fighting for an oxygen cylinder. You know, we have people, we have the exorbitant prices that are being, you know, implemented by private hospitals, and yet some of the government hospitals are also not helping. The key issue is the health sector budget.
Flavia,
how do we increase
Flavia
it?
Nabagabe, given the severity of the situation, the fact that cases are rising exponentially, people are dying, there's a slow response from government over the interventions. Do we envisage a situation whereby we extend this lockdown under the guise of let's continue giving people money who are vulnerable?
That is not
sustainable.
sustainable.
The cases are rising.
That's not sustainable. At some point, government has to end the lockdown.
But do you envisage an extension of the lockdown at some point when we end this for the 2 days? Given the factors that I've just mentioned.
I think it will be, I actually envisage that because one, not so many people have been tested. So we still have low numbers of people who have been tested. So we don't really know who has the virus and who doesn't. Because people are still under lockdown. I just gave you an example of Kasanda district of 360 people. We only have 220 that are vaccinated. But also, I think for me, the critical issue here that we have to deal with is this COVID-19 has exposed a number of glaring gaps in our health sector. It is time that we put priority on funding the health sector budget to be able to clear medical workers and but also it is time to hold accountable those that are misusing our funds. Let them resign.
Funding and accountability. Flavia Nabagabe, thank you very much. Let's also give some few seconds to Lydia Onyoto to talk to us about what kind of interventions government should expedite moving forward to curtail the spread of COVID-19. What else can we be doing as a government to curtail the spread?
Let me first of all make some comments.
Please react, but we have 2 minutes.
You're the one who gave me the 2 minutes. I was here in time.
Go ahead.
But I have to respect the moderator.
Indeed.
So the first thing, the advice I want to give to Honorable Karule here is to go to Parliament with an open mind and look at all the sectors. Don't popularize or politicize the budget cuts. I've had some of your colleagues saying, you know, we get 4.5 million subsidy allowance, let all of the money go to COVID. Don't do that. Don't now debate the allowances and money of members of Parliament and then the State House budget. On media, when you have the right legal forum to do it. Go to Parliament, look at the parliamentary budget, look at the presidential budget, look at the ministry budget amongst yourselves using your... we gave you the mandate.
I think she was pointing
out
that.
I'm just giving... no, I want to be clear because we've seen this debate and you drag in the population, even the hate campaign start. Because they are her colleagues who are now saying, let Parliament give money for... Don't do that to the public because you have the forum.
Let's wait and see what happens.
You have the right forum. Just go with an open mind and look at other sectors without pinch-punching each other because it's not the interest of the people, even in your own interest as our leaders.
Indeed.
Just go and do your work. For us, we shall mobilize. We shall support the decisions you take. So on money. So the second issue is the issue of the health sector. The health sector worldwide, we might have gaps. I also agree that maybe some people, for me, my biggest challenge was on data. We have the delay was because of data. There was no correct data about the vulnerable. I hope that we can build onto that in the future and have better interventions on that. That's what has delayed.
Indeed.
But the delay is in good faith because if the moment it is set out to go, the rightful will get the money. There will be very few incidents of omission or commission. But for the future, we need correct data, and I think there was a gap there. For the health system, it's again in your hands. If members of Parliament and the government can now work out, because we have buildings, we have health centers which are building, but what is lacking are the human resource competencies and the supplies for these health centers. But for the pandemic, or the health sector of Uganda, I think we have... they have tried so much to save life. We've lost people, it's very painful, but many more people have been, we have testimonies out there where people have survived the pandemic because of the robust health sector that came out to work.
Lydia Onyoto, thank you very much for having made the time to speak to Morning at NTV. She heads NRM's Women's League. We do not take that lightly. You are a very busy woman. And also Kasanda woman MP Flavia Nabagabe representing Kasanda and also NUP's Women's League. Thank you very much for that undeterred support that you show the vulnerable people of this country. We do appreciate. And my name is Romeo Busiku. John Paul Bagala, an obstetrician and gynecologist, is already here to talk about early antenatal child care. We'll be right back.